Today I'm going to talk about simple back pain solutions. Low back pain is the leading cause of pain and disability, and as a physio, I really struggle a lot to cure people with back pain. But I can tell that if only people follow these things, at least they can prevent themselves from having chronic catastrophizing low back pain, or even if you have a back pain, by following these things, you can actually have a way to come out of that. The first thing is learn to sit erect, because most of the people are currently in the software field or either a sitting job. Most people doesn't know how to sit erect. So if you learn to sit erect, and as much as possible if you practice that as a habit, then you may have less compression force in the lumbar spine. So because most of the back pain is due to the compression of the disc, and then the disc related back pain and the nerve pain, so it's better to have less compression on the back. So if you sit erect, the compression on the back will be less compared to when you slouch. So learn to sit erect. Secondly, avoid prolonged sitting. See, sitting is a new smoking, we know that, but of course, we can't escape from sitting. But all we ask is, at least you get up and move around every now and then. So if you're sitting for 30 to 40 minutes at a stretch, try to get up and move around for about 3 to 4 minutes and then come back and sit, so that you can break the monotonicity of sitting. If you sit for a long time in the same position, you will create a pressure concentration point. What is pressure concentration point? Same point will be compressed for a longer period of time, will undergo faster wear and tear than when different points are pressurized at different point of time. So to avoid a pressure concentration point, you have to change your position, get up and move around, so that you avoid pressure concentration points. Thirdly, you need to keep walking, because when you sit, the spine will be in a forward bending posture. The best alternate for, or the best opposite movement for sitting is standing or even walking. So when you walk, whatever compressive forces you have been applying on the back while sitting will get nullified when you walk. So have a habit of walking at least 30 to 40 minutes a day. It should be a kind of brisk walking that will be helping you. Fourth one is avoid repetitive frequent bending, especially when I see the patients who are housewives. They bend 100 times in a day, picking up objects, moving furniture, mopping, sweeping, cleaning. So their entire life is full of forward bending. See, if you bend once or twice, it's fine. But if you bend 100 times in a day for about 10 years, then you are also a likely candidate for low back pain. So when you're bending, you keep your spine erect and then use your knees and hips to pick up the objects, so that you spare your spine. So use up your hips and knees and spare your spine. So in that way, you can preserve your disc from getting degenerated. So avoid frequent bendings or even weightlifting. Now, one of the triggering factor for the low back pain is lifting heavy weights. So when you are lifting heavy weight, keep your spine erect and then you lift the weight, especially in the morning when you lift cylinders or lifting your baby or moving your furniture. Try to brace your back and keep your back erect and then you lift the objects. And even if you are in the gym, make sure that you get a proper form and then do the deadlift and weighted squat, because if you're not having a right form, then easily you can get injured in the gym. So in the name of weightlifting, you injure your back, and then strength doesn't matter here, because when the disc is compressed, it doesn't care whether your muscle is strong or not. So make sure that when you lift weight, you keep the right posture and then you lift the weight, and then you reduce your body weight. So because the entire body weight will be having to pass through the disc only. So if the body is heavy here, then the weight that passes through the back will be more. If the weight is less in the upper body, the amount of weight that transmits through the disc will be less, so the disc will be happy. For example, if you lose 5 kg in the upper body, that 5 kg will be reduced in the disc as well. Especially weight loss will be helpful in long run in minimizing the risk of getting the low back pain. Apart from that, if you are obese, you will have high fat level and high glucose level in the body. It will cause more inflammation. So you know that some back pains are inflammatory back pains. So in such cases, reducing the body weight will actually reduce the overall bodily systemic inflammation. In that way also, you will be having less back pain if you have less body weight. Okay. Finally, avoid repetitive, monotonous movements or postures or activity. I'm not even saying that slouching is bad. Slouching too long for too many weeks or too many months or even years, that time is the factor here that causes the problem. So avoid these sustained postures or monotonous movements, repetitive movements which are doing in the same way again and again. The body likes movements, the body likes varieties, the body likes novelty. So the more the varieties of movements that you do, the better it is for your body and as well as for your back. So if you are doing sitting job, pick up some recreational activity which is opposite to sitting, but don't pick up golfing, because sitting and golfing is one or the same. Okay, rather you have to pick up jogging or swimming, so that you break the monotonicity of what you do in the office in the form of your recreational activity. So if you follow all these things, perhaps you don't even have to think about what exercise you have to do for the back pain. Just follow these things. There's a very good chance that you can come out of your back pain, or significantly your pain can get reduced. All right. I hope this is useful. Thank you.